Hello friends, my name is Rahul Dev and I am Assistant Professor in Access Institute of Pharmacy. Today I am going to discuss about the introduction to pharmaceutics first, a very basic fundamental needs for the B.Pharm first year student to their core subject pharmaceutics first. Let's start. What is pharmaceutics? Pharmaceutics is the discipline of the pharmacy that deals with the process of turning a new chemical entity into drugs into a medication. A medication means a dosage form like solid, liquid, aerosols, and gas formulation to be used safely and effectively by the patient. It is also called the science of the dosage form design. In the pharmaceutics, drugs are rarely used alone, but it is used in a combination with some other active pharmaceutical ingredients that are known as additives or excipients that provides the basic drugs to make a dosage form acceptable. These excipients in combination with drugs make them acceptable. And the first of the content of the pharmaceutics first. In this content of the pharmaceutics includes their history of the pharmacy, prescription, posology, and introduction to the design, dosage form design. Unit seconds includes pharmaceutical calculations, solid form, solid dosage form, like powders, and introduction to liquid dosage form. Unit thirds includes detailed study about the liquid dosage form, both monophasic dosage form and biphasic dosage form. Monophasic dosage form means that kind of dosage form which has only one phase but more than one component, like syrup, which has only one phase to be visible but has two components, sugar and water. Second one is biphasic liquid dosage form, that is emulsion and suspension. These emulsion and suspensions have two clearly visible liquid dosage forms. Fourth unit of the pharmaceutics includes suppositories and pharmaceutical incompatibilities. Unit fifth includes semi-solid dosage form, means it contains about the study of ointment, paste, gels, jellies, etc. So let's start with the unit first. It has some objectives. Each and every one unit has some objectives to study. Unit first has objective. It includes and it enables the student is about the stepwise step development of the ancient pharmacy to the modern pharmacy. Means it includes the information about start of the pharmacy. First pharmacopoeia has been published, and detail about the when was the first medical stores was open, when was the first apothecary was open. It enables the student with the future perspectives of the pharmacy profession. It also provides the better understanding of the importance and application of the pharmacy as a career, and the pharmacy as a career has a vast importance, and it is used in a very wide field, like it is used in a research and development, formulation and development, as a uh, pharmacist, as a diagnostic person. It also includes about the official drug compendia of different countries. In India, we use like the official compendia of the drug known as Indian Pharmacopoeia, which is published by under the supervision of Central Government of India, Department, Government of Health and Family Welfare. It also includes about the prescription. What is the prescription? Prescription is a written order that is given by the medical practitioners or doctors to the pharmacist to dispense medicines according to the that prescription for the betterment and safety of the patient. First unit comes about the let's now start with the classification of the dosage form. The classification of the dosage form means we have four types of dosage form, like solid, semi-solid, liquid and gas. The solid dosage form, these type of those dosage form which has this particular shape, structure. This solid dosage form has tablets, capsule, pills, etc. These are unit dosage form, and these are bulk dosage form also. Bulk dosage form means like powder, dusting powders, absorbable powders, etc. Second dosage form are semi-solid dosage form. These type of dosage form has both the properties of the solid and liquids, and it includes cream, paste, gel, ointments, etc. Third one is liquid dosage form. The liquid dosage form, as we studied before, monophasic and biphasic. Monophasic, which has only one phase, like syrup, solution, elixirs, parenterals, means injections, etc. Second one is a biphasic liquid dosage form. These are the dosage form which has two phases visible. For example has emulsion and suspension. Emulsions are has two clear phases of liquid like water and oil. Suspension has two clear phases. One is a solid and the other one is liquid. Example like sand is dissolved in water. Sand is present in water. The fourth dosage form are gases. Gases, we use gases like inhalers, aerosols, etc. These are the type of the dosage form. This picture shows the different type of the dosage forms: tincture, dried herbs, pills, capsule, throat paints. All these are the marketed products we have already seen and use most of them, these products, for our health and treatment. Unit seconds includes how the dosage forms are calculated, how much amount of the dosage form has been given to the different types age group patients, for maybe like children's, maybe like elderly patient or adult patient. This unit also provides a study of the discrimination between the different types of solid dosage form like tablet, capsules, powders. It also includes and provides the differentiation and between the different types of powders. It also classify and gives the knowledge about the different classifications of the powders on the basis of the different pharmacopoeia like absorbable powder, dusting powder, catchets, insufflations, etc. This also enables the student about the powder dosage form which has absorbing capacity of water like hygroscopic powders, deliquescent powder and dry powder. Student also understand dispensing, preparation, formulations, packaging, storage of the powders. This unit second enables the student about proper storage ability of powders, how the powders can be packaged, how their labeling can be done, how they can be stored. Along with this unit second, student also understand about solubility and factors affecting the solubility and how we can increase the solubility. Solubility means it is the process of movement of the solute particles into the solvent at particular temperature. And next, this slides represent the classification of dosage form. This classification of dosage form, these dosage forms are classified on the basis of following factors. First one is route of administration, about on the basis of their physical state, on the basis of their uses, and on the basis of the site of applications. First, on the basis of route of administration, they are like as oral, parenterals, sublinguals, intrarespiratory, urethral, transdermal, vaginal, rectal, intraocular, conjunctival, intranasal, etc. Oral dosage form like powders, tablets, capsule, solution, emulsion, elixir. These are taken up by the mouth and oral routes. Sublingual tablets are those tablets which are taken at below the tongue at this place. Tablet example of sublingual tablet is nitroglycerin tablet. Parental formulations like injections, these are given by intramuscular, intravenous, intraarticular, subcutaneous, etc. Intrarespiratory means aerosol. Transdermal are those which are applied over the skin, and drugs travel into the far systemic circulation. These includes like ointment, powders, cream, lotion, paste. Conjunctivals, ointment. These are the examples, and soft solid dosage form like powder, granules, tablet, capsules, and suppositories. Powders, what is the powders? Powder is a mixture of finely divided drugs and chemicals in dry form in a solid dosage form, meant for internal and external use and available in crystalline or amorphous form. Means powder एक ऐसी dosage form है जो कि यूज किए जाते हैं, सॉलिड डोजेस फॉर्म होती हैं, ड्राई फॉर्म में यूज होती हैं और क्रिस्टलाइन और एमॉर्फस फॉर्म में प्रेजेंट होती हैं. Now let's move to the objectives of the unit third. Unit third make the students enables to understand about liquid dosage form, their types of the liquid dosage form like monophasic liquid dosage form, biphasic liquid dosage form, formulations, method of dosage form, composition of liquid dosage form, their storage, packaging, etc. It enables the student to understand differentiation between the syrup and elixir. Like syrup is a sugar solution, hydro sugar solution, it consists sugar and water, while elixir it is a hydroalcoholic solution. How to prepare ear and eye drops. Students came to know about emulsion and suspension. This emulsion and suspension is an example of biphasic liquid dosage form. In types of ingredient use and methods of preparation of liquid dosage form. Factors affecting the stability of emulsion and suspensions. Packaging, labeling, and storage of the liquid formulation. What are the liquid dosage form? This picture shows the types of the liquid dosage form. Liquid dosage form are two types, monophasic and biphasic. Monophasic includes for the oral use, external use, parenterals, spatial use. Monophasic means are those type of liquid dosage form which has only one phase to be clearly visible. This monophasic dosage form includes one phase but more than one component, like syrup or sugar solution. Sugar solution clearly has one phases liquid dosage form to be visible, but it contains the two components, a sugar and a water. Simply, the other example is alcohol dissolved in water. It has two components. First one is the alcohol and water, but it has two components but has only one phase. The biphasic liquid dosage form. The biphasic liquid dosage form are those liquid dosage form which has two phases clearly visible. This includes emulsion and suspension. Emulsion is that type of biphasic liquid dosage form in which two liquid dosage forms are present and clearly visible, like oil dissolved in water and water in oil. This oil and water are not easily mixable to each other, but in the presence of some other substance, emulsifying agent, they are make a stable doses. Let's come to the objectives of the unit third of the pharmaceutics first. After reading this, students becomes able to answer the following questions like they must come to know about the description and details of the liquid dosage form. In this liquid dosage form, they will understand two types of the dosage form, monophasic dosage form and biphasic dosage form. After this, they have known about the classification of both the monophasic and biphasic dosage form. They will able to differentiate between the syrups and elixirs. Syrups, this dosage form is sweetened liquid solutions, and elixirs are the hydroalcoholic solutions. How we prepare the eye drops and ear drops. Students came to know about the emulsion and suspension, the most important biphasic dosage form. Emulsion and suspensions. In emulsion, there are two phases, oil and water, and suspension, there are two phases. One is a solid and other is liquid. In this unit third, students also came to know about the types of the ingredients used to prepare the both types of monophasic and liquid dosage form. They came to know about the theories of preparations and methods of preparations of the emulsion and suspension and other liquid dosage form. They come to know about the syrup, elixir, solutions, their formulations, their evaluations, packaging and storage. After this, they students will know about how the factors affected the stability of the formulations, stability and solubility of the suspension and emulsions. This picture shows different types of liquid dosage form. First one is the monophasic and the second one is the biphasic. A monophasic liquid dosage form is that liquid dosage form which has one clear phase but more than one component, like syrup solution or the sugar solution. In the sugar solution, there are two components, one is the sugar and other is the water, but the sugar is completely dissolved in the water and make its only one visible phase. That's why they known as the monophasic liquid dosage form. This monophasic liquid dosage form has another example of water mixed with alcohol. In this, alcohol and water both are the two components, but they clearly visible has only one phase. This is the biphasic liquid dosage form. Now, biphasic liquid in the biphasic liquid dosage form, there are two clear phases. One is both the phases are either solid or liquid or liquid. If the two phases are liquid and liquid, then this prepare emulsion, and if one phase is solid and the other phase is liquid, then this prepare suspension. Now comes to the objectives of the unit 4. Unit 4 is a very well and different parts. This includes a different type of dosage form known as the suppositories. Suppositories are solid dosage form, but they are intended to administered in the body by non-conventional route. This non-conventional route means the drug or suppositories are not administered through oral route or mouth, injections, parenterals, topical application, but these are administered into the body by the body cavity. In this unit, students again came to know about the preparations, formulation, compositions, method of preparations of the suppositories. They also known about the formulation of suppositories. Suppositories are a special dosage form and they require some special conditions to be prepared. So students come to know about the ingredient used in the preparation of the suppositories, especially focuses on the suppositories base. Suppose in the preparation of the suppositories base like oil base like cocoa butter and other oils are mainly used. After this, a student knows about the evaluation of the suppositories, and this suppositories preparations, a student came to know about the incompatibilities. This is the suppositories and it has a definition. Its suppositories is a solid dosage form meant to be inserted into the body cavity like rectum, urethra, vagina, where they melt or soften to release the drugs and produce their local or systemic effect. The picture shows about the suppositories of the different shapes. This picture has the concept of suppositories, how to deliver or administer the suppositories into the patient for their treatment. The suppositories given by the different routes has different shape and size, different weight and size. Like rectal suppositories are taper resemble or torpedo shape and weigh about 2 gram for adults and 1 gram for children. Vaginal suppositories, these are molded in the globular or oviform. They have oblong or ovule shape or compressed on a tablet press into modified conical shapes. Vaginal suppositories weigh about 3 to 5 grams. Like urethral suppositories, these are also called woogies and have pencil shape. In the fourth unit, the another topic is pharmaceutical incompatibilities. This pharmaceutical incompatibility means there is a change in the physical, chemical or therapeutic nature of the prepared formulations due to there is a unwanted chemical reactions between the drug excipients or excipients. If the drug excipients or excipient and excipients reactions are becomes harmful or for the formulations, this causes the incompatibility in the formulation. The pharmaceutical incompatibilities are three types: physical, chemical, and therapeutic compatibilities. Physical incompatibility means there is a change in the color, odor, taste, texture, appearance of the prepared formulations. And in the chemical incompatibilities means there is some changes in the chemical reactions or chemical nature, chemical effect of the formulation. Therapeutic incompatibility means if there is a unwanted chemical reactions between the drug excipients or excipients, they causes a change in the therapeutic response of the formulations. Maybe let's take an example. If two drugs are given with in a combination, they both the drugs if increase their response of each other, it means they shows the synergistic effect. And if when two drugs are given each other and that time one drug depress or suppress the action of the other drug, this action is called antagonism. Last object unit has unit fifth. It includes the description, details, formulation, packaging, manufacturing, ingredients, combinations of ingredients to prepare semi-solid dosage form. The unit fifth is a semi-solid dosage form which includes preparations, formulations, classification, detailed descriptions about the ointment, paste, gels, jellies, etc. This unit enables the student to differentiate between the ointment, paste, capsule, ointment, paste, gels, jellies, etc. After the study of the unit 5th, students understood how to prepare, how to package, how to store semi-solid dosage form, and how to deliver the semi-solid dosage form. Semi-solid dosage forms are delivered or applied by the topical routes or topical application. These are intended to be used on skin. Semi-solid dosage forms are the dermatological products of semi-solid consistency and applied to skin for therapeutic or protective actions. These are also used for the cosmetic functions for the localized drug delivery. The picture shows semi-solid dosage form include drug delivery systems and dosage form intended to be applied to the skin. So there examples of the semi-solid dosage form like ointment, creams, gels, paste, etc. This is all about the pharmaceutics first, and it is the introductory part of the pharmaceutics first. Okay, thank you.